the chairman.
I am a pharmacist, meeting global health needs.
I'm a pharmacist, meeting global health needs.
I'm a pharmacist, meeting global health needs.
I am a pharmacist, meeting global health needs.
I am a pharmacist, meeting global health needs.
I'm a pharmacist, meeting the global health needs.
I'm a pharmacist, meeting global health needs.
I am a pharmacist, meeting global health needs.
I'm a pharmacist, meeting global health needs.
I am a pharmacist, meeting global health needs.
I am a pharmacist, meeting global health needs.
I'm a pharmacist, meeting the health global needs.
No trust and those made in order who we stand. Nigeria so are proud to serve our sovereign motherland. Stanza 2. Our flag shall be a symbol that truth and justice reign. In peace or battle or not, and this we can't as gain. To hand unto our children a banner without stain. Third stanza. O God of all creation, grant this our request. Help us to be the nation where no one is oppressed. And so with peace and honesty, Nigeria shall be blessed.
Beautiful, beautiful. Please a round of applause for our fellow. Thank you, please. May we have our seats. I observed that while he was singing, our older pharmacists were happier. I don't know why. Maybe because it was their anthem. The one we are used to has been abolished. Please, moving forward, I want to invite a few persons to the top table. Let us clap as we welcome the members of the board of the hospital's management board. Please, can we welcome them and put a round of applause for them? Thank you, thank you. You are welcome to Ondo State Pharmaceutical Society of Nigeria. Mr. Chairman, sir, please have your seat. I want to bring to the top table. A few dignitaries. We are all very important personalities, but please permit me to invite my Oga, the Executive Secretary of the Ondo State Drugs and Health Commodities Management Agency, Pharmacists, Amos Ayebusi. Is he in the house? Okay, he will join us later. Please, I also want to bring to the top table one of us. He is the keynote address speaker for today, and he is also a member of the board of the hospital's management board, Pharmacist Dr. Taiwo Adeforin. Please, to the top table. Okay. Sorry for that. I jumped protocol. I was told to invite to the top table the chairman of the board of the hospital's management board, Dr. Taiwo Fashiranti. That thing. That projector, people can remove it when they're ready, put it back. Because it's affecting the flow. It's affecting the flow. It's affecting the flow. We're sorry for the breaking transmission. I want to make everything perfect. Please, Tolu. This is what they will use to do presentation. I'm glad to inform us that today's celebration is unique in the sense that Mr. Governor will be gracing us with his presence. Are we not happy to hear that? Mr. Governor is coming, and again, the Deputy Governor will also be honoring us today. There are pharmacists we call celebrated pharmacists. When you get to that level, we call them celebrated. Please permit me to recognize. I will not be able to mention their names. All fellows of the Pharmaceutical Society of Nigeria. They are all in their own regalia. Please, shall we rise and recognize them? Thank you, thank you, thank you. We are proud of you. We pray one day we will also get there. Please, I also want to recognize the Director of Pharmaceutical Services, Hospitals Management Board, Pharmacists, Omoba. Can we put our hands together for her? Thank you very much, ma'am. May I also recognize the State Officer of the PCN, Pharmaceutical Council of Pharmacy Council of Nigeria, Pharmacist Kingsley. Thank you very much, sir. We also have in our midst the Area Commander of the Nigerian Security and Civil Defense Corps. Okay. ACC Shade Ola Kense. Ola Kense, please. Thank you very much. Please, apologies for my sincere apologies. Permit me to recognize the Director of Pharmaceutical Services, Federal Medical Center, Owo, Pharmacist Adeyeye Queen. You are welcome, ma. May I also recognize the Director of Pharmaceutical Services, Ondo State Primary Healthcare Development Agency, Pharmacist Sergio Grace. It's calling you. We also have in our midst representative of NAFDAC Director, Ondo State, Aliu Lorat. Please, thank you for gracing us with your presence. May I recognize the chairman of Association of Community Pharmacists of Nigeria, Ondo State Branch, Pharmacist Solomon Adetunji. In that same vein, I also want to recognize the chairman of happening. Please permit me to welcome Fagbemi. He is the chairman of Association of Hospitals and Administrative Pharmacists of Nigeria. Thank you, sir. I know I may not know the name of all of us. We are all very important. I know my ogas are seated here, directors of hospitals, pharmacists, directors, HODs are all here. Please, let's clap our hands together for the years, the performing years, the executive secretary of the Drugs and Health Commodities Management Agency, Pharmacist, Dr. Amos Ayegusi. We left here late yesterday. He was here. It was a very fruitful meeting. He's here again. I was just informed that the Permanent Secretary, Ministry of Health, will be joining us. Commissioner of Health will be joining us. The essay on health is also coming. That is what you get when you have a chairman that is highly connected. Can we give it to that chairman, please? The chairman yesterday mentioned something that is interesting. I mentioned yesterday that he has a twin brother, and I called them the youth leaders of the Elders Forum. And he said we do everything together. We do bad things too. I don't know where he's going. No, I don't know. If you have seen these two in conferences, boys, be ready, because they wear very good jeans. I don't know where they are going, but I see them wearing tight and correct jeans. And then he mentioned and confirmed that we do bad things. I don't know what kind of bad things they do. Please, let's celebrate these two friends that have come very far. Very, very far. Thank you, sir. I had a very long and beautiful ride with Pharmacist. Thank you very much, sir. At this point, please, we'll still do further recognition. So please, before I forget, let me celebrate one woman who has put this together. She had done a very beautiful job. This is the first time we are seeing in the history of PSN and in the celebration of our week that we are doing a live streaming. So please, on our platform, we are live on YouTube. This program, it's everywhere. So please permit me to recognize the chairman of the Pharmacy Week Committee and the chairman, same, of the World Pharmacist Day Committee, Pharmacists, Oluwatimileyin, FPSN. Let's celebrate her. Thank you very much. At this stage, let me invite her officially to come and give us the welcome address. Please, let's welcome the chairman of the World Pharmacist Day Committee for our welcome address. We are not clapping, we are not encouraging mommy. Thank you very much, ma'am.
The chairman of the occasion, sir, members of the high table, it gives me great pleasure to welcome all our guests and colleagues to the 2024 World Pharmacists Day program. Nigeria is a member of the International Pharmaceutical Federation, FIP, which is the world body comprising of pharmacists and pharmaceutical scientists all over the world. At the annual conference of the organization in Istanbul, Turkey in 2009, it was decided and adopted that the 25th of September every year should be declared World Pharmacists Day, because FIP was actually birthed on the 25th of September 1912. The purpose for the World Pharmacists Day was to encourage activities that we promote and advocate for the roles of pharmacists in improving healthcare services in every corner of the world. The theme for this year is Pharmacists, Meeting Global Health Needs. This implies that in whatever area of practice, pharmacists must be able to meet the needs of the community. The 2024 Pharmacy Week Committee, in tandem with this year's theme, proposed a 3-day program to the PSN executive, and this was adopted. These were medical outreach to the community in the PSN 5 zones of Ikare, Owo, Akure, Ondo, and Okitipupa. Career talks in selected secondary schools in the 5 zones, and meeting between the Ondo State Drug Management Agency and some pharmaceutical companies. The grand finale is what we are seeing today, and this involves the unveiling of the billboard. It involves the World Press Conference that has been done by the PSN chairman. There is going to be a keynote address by our erudite scholar, and there is going to be an interactive session for us to meet with our colleagues and ask questions. Some companies have already been doing their exhibitions since yesterday, and these are all to meet the needs of Ondo State community. I want to appreciate the Ondo State PSN executive for the opportunity given to me and members of my committee. I thank the committee who have worked assiduously with me for the success recorded. Appreciation to our burden bearers, the companies, the community pharmacists, and individuals who have been able to exhibit and send goodwill messages for us. My address will not be complete if I fail to recognize and appreciate the Creator and God for the abundant grace, favor, good health that we all enjoy. Please relax and enjoy the full package we have in store for you. Thank you, and you are welcome.
Another round of applause for mommy. Please. I need a copy of the brochure, please. Our slogan is, as men of honor. As men of honor, this does not apply if you, as a pharmacist, if you are not joining hands. This does not apply to you as a pharmacist if you say a colleague is not a pharmacist. This does not apply If you say a pharmacist is more than a pharmacist.
All right. Good morning, everyone. All right, my name is Pharmacist Debisi Igbagboyemi, and I'm here this morning to represent drug-free pharmaceuticals. First, let me begin by wishing us a happy World Pharmacist Day. You know, one thing about drug-free is that we value pharmacists so much, and in the ever-increasing global health needs, we appreciate the significant impact you are making in meeting these global health needs. And it might interest you to know that, like we always say, that drug-free is Ondo State, and then Ondo State is drug-free. The reason is that the vision of drug-free, that is to become the leading pharmaceutical multi-dosage manufacturer in Nigeria, it actually began from this city of Akure. Our MD, the CEO, Pharmacist Olakule Kundayo, is an indigene of this place. And I think it's something that we should celebrate. So, and I bring you greetings from him, and he's so happy, and then he celebrates us, especially PSN Ondo State. Please kindly permit me to stand on existing protocols. Thank you so much. So, drug-free pharmaceuticals. This is our vision to become the leading pharmaceutical multi-dosage manufacturer in Nigeria. And how do we do this? We do this by to improve quality of life through production, distribution, and sales of quality, safe and effective medicines. You know, there's something about our products. We always call them excellent products from a sure source. And of course, like I said earlier, you know, the source is actually right from here in Ondo State. So you can trust our products. We have products across different therapeutic classes, ranging from antifungals, anti-allergies, anti-malarials, and antihypertensives. I'm sure many of us are familiar with some of our products like Hansalad, Betadrogen, Ice Drop, and so much forth. And of course, we are still in the process of making much more than you can, that can be very useful for us in our practice. So today I'm just going to take you through some of our products that at our exhibition stand, and then I'm going to introduce you to one of our latest products that will be very, very useful for us in practice. This is our Tromycin eye ointment. That is erythromycin eye ointment. It's for the prophylaxis of ophthalmia neonatorium. Then we have Chlorhexidine gel. That is chlorhexidine. And of course, this product actually got us so much awards as a company. You know, it's our innovative brand. And then at the same time, it's one of the products that we're also exporting out of the country. So Chlorhexidine gel is basically for prevention of umbilical cord infections in newborn babies. These are our mycotin baby cream. It contains clotrimazole and ishtamol for nappy rashes, eczema, skin irritations, itching, and all that. Then we have our brand of sulfadoxine pyrimethamine. That's Drupidox for prevention of malaria, and at the same time, for intermittent preventive treatment in pregnancy. Yes, and this is Repsogel, our mosquito repellent. Now, one thing about this product is that it's not irritating to the skin, like any other mosquito repellent that you may have come across. And this Repsogel, you know, malaria burden, the burden of malaria is quite high in this country. And of course, there has been this increasing resistance to available anti-malarials. So, and that's why our company have come up with this particular product. You know, we believe that prevention is always better than cure. So in the preaching of the message of Repsogel, you know, by stopping mosquito bites, there we can stop malaria. And one good thing about it also is that it has over 8 hours protection. So by the time they apply it, you know, it lasts for 8 hours. That is, if they apply it at night, it lasts all over the night. Yeah, and then we have our Hemo Plus cream, you know, for the treatment and management of both internal and external PI. And PI is actually very common in pregnant women. And this Hemo Plus cream, it contains chlorhexidine, antiseptic, hydrocortisone, anti-inflammatory, and then gentamicin, of course, an antibiotic. So it makes it very, very effective. Triple therapy. And we have gotten so much good reports about it. So the products are also available at our exhibition stand. So this is our Hepla Blood Tonic. It comes both in syrup and then capsule. We have our promethazine syrup, and then we have our ibuprofen syrup too. Then this is our cough syrup, you know, both for children and adults. I'm sure most of us are familiar with these products. Then we have Balsine syrup, you know, nicomycin, and majorly for bone and joint infections. And then also useful when it comes to skin and soft tissues infections too. And one thing about Balsine syrup is that it's well tolerated in neonates. Then this is our Mycotin Plus. You know, it's one of our vulvovaginal products, and very good when it comes to vulvovaginal infections. It contains clotrimazole and clindamycin. Many of us are familiar with our mycotin, that's the antifungal, just clotrimazole, but this comes with clindamycin, an antibiotic. So it makes it very effective for bacterial vaginosis. So it takes care of aerobic vaginitis, bacterial vaginosis, and candidiasis. And then we have this cofepron syrup. Cofepron contains salbutamol, guaifenesin, and then bromhexine. Cofepron's cough syrup is very, very useful when it comes to chronic obstructive pulmonary diseases and also for productive cough. This is the ideal combination for that. So today I want to introduce us to our newest product, Permethrin cream. I'm sure in our retail outlets, we've seen a lot of people come in and begin to complain of itching. I think it's quite common recently now, at least one or twice in a week. You see people come in and then they begin to tell you that their whole body is itching them. Some even call it different names. Some say sweating and all of that. So, and it's most times the condition that they're actually battling with is scabies. And that's why we have come with this Permethrin cream, which is very, very effective when it comes to scabies. So let's briefly talk about scabies as it is. Now, scabies is basically an ectoparasitic skin infection, and then it is caused by these tiny mites called Sarcoptes scabies. And what these mites does is that they burrow into the skin, lay eggs, and of course also defecate on the skin. And in the process of carrying out these activities, they cause intense itching and form a rash. Then the risk factors, basically poor hygiene, and of course we also have nutritional status, bringing about low immune system, and of course homelessness. Then it's also common in overcrowded areas, places where there is overcrowd, and then also in tropical regions too. Then the transmission basically is contracted through prolonged skin-to-skin contact. When there is a prolonged skin contact with someone that is already infected with a mite, so there is that, it is easily transmitted. And then the signs of infestation, that is the clinical features that you're going to see. One is itching, and then the itching is just the basic thing. The whole body is going to be itching them, and then it's often severe and usually worse at night. And then another thing is that they actually form what we call reddish bumps, on the skin. You're going to see reddish bumps on the skin. So by the time you begin to see it, and the location of those reddish bumps, and then you see it at the chest area, the hand, we call it wet spaces in between the hands. You see those reddish bumps there. Then you also see it on the genital areas, the elbows, the wrist, and all other parts there. So that's the life cycle of the mites. The mites, the adult mites, lives on the skin. It can live on the skin for up to 4 to 6 weeks. And in the process, lay eggs. And of course, the eggs begins to grow. And then it continues like that, begins to transform into one form to the other. And the symptoms usually develop 4 weeks after infested with these mites. The epidemiology. Like I said, that we see cases of people coming into our retail outlets and say that they are experiencing itching. So you see that at least twice in a week. So there are over 300 million cases worldwide in a year. And then it affects more children in poor and overcrowded tropical areas. And of course, like I said, like overcrowded areas is one of the risk factors of getting infected with that particular mite. Then it affects both gender equally. It's not gender biased. Then we have, in the rural environments, there is 14.12%. Then in the urban, 5.88%, based on a study, a Nigeria study conducted. And that shows that it occurs more in the rural areas. And of course, outbreaks often occurs in hospitals, nursing homes, prisons, kindergarten, classrooms, and IDP camps. Of course, most of those places that I mentioned, they are overcrowded, so they are expected to see them there. So the diagnosis, this mite, they're very tiny, so it's not something that you can easily see with our eyes. So sometimes microscope, with the help of microscope and a scaling scrub, you can easily see, you can see the mind. So mainly by physical examination and history of concurrent infection among close contact. By the time we begin to interact with the patient and ask that, okay, are you the only one experiencing this itching? Are there other people experiencing the itching at home and all of that? Then you begin to see that, okay, it's most likely scabies. Then it is usually mistaken for other pruritic skin infection. And so like I said, differential diagnosis relies on the microscopy of the mites, eggs, eggshell, and all of them. So let's come to the treatment options now. For the treatment options, well, basically, a lot of people manage the symptoms with antihistamines. But for what actually kills the mind, there are two ways about it. One is the oral, that's by taking ivermectin at 300 microgram per kg. And the other options are to make use of topical creams. And there are like 4 topical creams. And then there's also another treatment option that I'm sure most of us are familiar with. That's the use of lotion, but there's benzoyl. But there is a particular something related to that. You know, a lot of people will complain to you that it's hot, and then they can't apply it on their genital areas. So, but these creams now, they are actually very effective for that. Now, let's now single out our products, permethrin cream. Like I said, 10% sulfur, permethrin cream 5%, nidane 1%, cotamidone 10%. And then from that graph, you are going to see that the percentage cure rate after 7 days, the blue there is permethrin. You are going to see that it is only permethrin cream that gave a 60% cure rate. All other options, you know, they didn't give any, they didn't bring about any cure rate in the first 7 days. No, and after 14 days, it is only permethrin cream that gave 100% cure rate. So that makes it that permethrin cream is the most effective drug in the treatment of scabies. And so why permethrin cream? Of course, the effectiveness is high effectiveness against the mites, and of course it has low human toxicity. And it also has a very rapid onset of action. Cotamidone on its own, because of its toxicity, so it's not, there are not enough data that supports its continuous use. And for sulfur, it's kind of irritating, it's messy. So, but permethrin cream does not alter the oxidants and antioxidants balance in the blood of the patient. So that makes it the most effective for the treatment of scabies. Then, other non-pharmacological approach when it comes to management of scabies, it's important for us to also tell them to, you know, wash their clothes, their clothing, and ensure that they dry it using the hot cycle to prevent reoccurrence and to prevent reinfection with the mites. So, men of honor, I bring to you one of DrugFit's latest products, and I think we should celebrate that because this is not just DrugFit, this is Ondo State products, permethrin cream. Thank you very much. Kindly let this be your drug of choice when you are managing scabies. Thank you.
Thank you. Are there questions, or are we going to take questions together? Okay, please. Thank you very much. We want to invite quickly Shalina Healthcare for their presentations, please.
Good afternoon, men of honor. I'm Pharmacist at DBC Gloria, and I'll be presenting on behalf of Shalina Healthcare. I want to use this opportunity to wish us a happy World Pharmacists Day. Permit me to stand on the already existing protocol. All right, I'll be presenting on pain and ibucap as a solution to pain. I'll be talking about the anatomy and physiology of pain, common painful conditions, treatments, and ibucap as a solution to pain. At Shalina Healthcare, one of our goal is quality, affordability, and availability. Inflammation is the body's own response to injury, infection, or irritation, and one of the important signs of inflammation is pain. Pain is an unpleasant sensory and emotional experience associated with tissue damage. I'm very sure that we all have experienced pain at some point in time, or we've even had clients or patients that we've had to manage their painful conditions. So pain is something that we are all familiar with. All right, so there are two types of pain based on the duration and severity of pain. So we have acute pain and chronic pain. And then for acute pain, the duration lasts for hours to weeks, while chronic pain, the duration lasts for months to years. And then common causes of acute pain include surgery, trauma, sport injury, dysmenorrhea. And then for chronic pain, common causes of chronic pain include arthritis, back pain, and gout. Then speaking about pain assessment, right, you can assess this intensity of pain using a scale of 0 to 10, 0 representing no pain, and 10 representing worst pain possible. So this will help you to determine whether a pain is mild, whether it's moderate or severe. All right, I wouldn't want to bore us with all of these stories under the mechanism of pain. All right, so speaking about the mechanism of nociceptive pain and inflammation after tissue injury. So after a tissue injury, there is a generation of stimulus that produces phospholipids A, and that phospholipid is converted to arachidonic acid. And the arachidonic acid, it undergoes two different pathways that produces leukotrienes and prostaglandins. This pathway is important because we would see where the solution I'm presenting to us this morning, which is ibucap, where it acts around that, it inhibits that COX-1 and COX-2. All right, speaking about the efficacy and safety of paracetamol and ibuprofen combination in multimodal pain therapy. In management of mild to moderate pain, analgesic therapy that combines drugs with different mechanism of action has been proven to be effective with a relative decreased side effect profile. Paracetamol as a pain relieving medication is known to have analgesic property and is known to have antipyretic property, but no anti-inflammatory property. And that's where our ibucap, our ibuprofen, comes to play. Ibuprofen has analgesic, anti-inflammatory, and antipyretic activity. So it makes up for the an anti-inflammatory property that is lacking in paracetamol. Then the third ingredient in this fixed dose combination is caffeine. Caffeine acts as a central nervous system stimulant that blocks, due to the blockage of receptor neurotransmitter adenosine, and therefore it enhances analgesia produced by paracetamol and reduces lethargic feeling due to pain condition. All right, the rationale for the combination of these three ingredients is that it provides the two medications, paracetamol and ibuprofen, provides synergistic effects and improves treatment efficacy. Ibucap or ibucap forte has a triple effect. You can see that the paracetamol enhances analgesia, the ibuprofen acts as a powerful anti-inflammatory drug, while the caffeine acts as an analgesic adjuvant. And all of these three components present in ibucap or ibucap forte produces a powerful anti-inflammatory and analgesic action. All right, we can see the pictorial representation of the solution. That's the product I'm presenting to us this afternoon. The difference between ibucap and ibucap forte is that the ibuprofen in ibucap is 200 milligram, while the ibuprofen in ibucap forte is 400 milligram. And you can dose the ibucap forte as 1 capsule 3 times daily, while you can dose the ibucap as 2 capsules 3 times daily. All right, the indication of this product is indicated in arthritis, including osteoarthritis and rheumatoid arthritis. We've had some of those, our aged clients that come to us complaining of severe arthritis pain. This is a good solution to solve their pain problem. Then it's also indicated in dysmenorrhea and lower back pain. It's also indicated in traumatic injuries, including spot injuries, fractures, and post-operative edema. It's also indicated in non-articular rheumatism. And you have, under non-articular rheumatism, you could have sprain, strain, and bursitis. Then it's also indicated in bursitis and sciatica. All right, several studies have been done on the multimodal approach of combining paracetamol and ibuprofen. And one of such studies is titled The Efficacy and Safety of Ibuprofen plus Paracetamol in a Fixed Dose Combination for Acute Post-Operative Pain in Adults. And the results, the conclusion from that study showed that ibuprofen plus paracetamol fixed dose combination is conclusively an effective analgesic against placebo in acute post-operative moderate to severe pain in adults. And it's also superiorly well tolerated, including at higher doses. This is another study that was done. Sorry. All right, Ibucap offers superior efficacy and safety than other NSAIDs, and it has a rapid onset of analgesia than diclofenac, and it's a first-line treatment for non-chronic pain than other NSAIDs, and the combination offers similar pain relief to that of opioid-based analgesics for acute pain. In talking about the safety, it has lesser gastric side effects compared to aspirin, diclofenac, and aceclofenac. And then the combination does not increase safety concerns. So you need not worry about whether or not it is safe. Caffeine in Ibucap, it significantly increases ibuprofen efficacy in post-operative pain when given as a fixed dose combination. All right, then for Ibucap Forte, in period pain, it provides significant pain relief. It offers a faster pain relief, superior reduction in pain intensity than lower dose ibuprofen plus paracetamol. So if you need a product that would offer instant pain relief, your best choice definitely should be Ibucap or Ibucap Forte. All right, so men of honor, I present a solution to you this afternoon. Ibucap or Ibucap Forte, it is safe, it is effective, and it has a quick onset of action. Thank you very much.
Thank you very much. I wish I could talk like that. Ladies' voices are always like that. Thank you very much. Please, let's clap for her again. Thank you. Without wasting time, please, let me invite the young pharmacist.
Good morning, everyone. Standing on the existing protocol, my name is Tolulokpa Adamalekun Famdi, the PSNYPG State Coordinator, and I'm here to talk about our non-governmental arm, which is our NGO, which is MedTribe. PSNYPG actually started something last year that is very innovative and educative, and we called it MedTribe. What is MedTribe? MedTribe is the arm of YPG that conducts outreaches. So what we do is, we look for well-meaning individuals in the society that have money. So we tell them, you can give back to the society. So bring your money. They can bring $1 million, they can bring 500,000, they can bring 2 million, they can bring anything they have. Then we get drugs, we mobilize manpower, then we go to wherever they want within Ondo State to conduct an health outreach. They can do their own shirts, we will wear it. Anything they want, we can pattern it to suit them. But all we do is give back to the society. We've noticed that there are people in the society that actually have money. Thank you, sir. There are people that actually have money. Yes, people that make millions year in, year out. And out of it, they just feel, let me do something in my environment. So we can even do it in the primary healthcare center in your hometown. For those of us that live in Akure and you are from Ondo, you are from Okitipupa, you are from the extreme ends of the state, and you want to give back to your people, you can contact MedTrive. We will help you organize an outreach. You can come there and talk, just to let your people know that they have somebody somewhere that genuinely cares about them. There's something we cannot rule out of the society. We cannot rule out the fact that healthcare is very important. And there are many people going out without even checking their health. But you see, these outreaches, we can check their BP, their sugar level, we can check their hepatitis B status, we can suit it to fit you, just to make them aware of their health. We can even come to your local government to do health talk. Let's say you want to reach out to the drivers, to the Okada riders in your area, to the road transport workers, any sort of people, to the Agbegilodos in your area. You can invite MedTrive. We will come, we will educate them, we will do the outreach on your behalf. All you need to do is to bring money. Thank you very much for listening.
Thank you. I think, my chairman, you are listening, sir. Please, let's organize an outreach. We are here. MedTrive is very available. Tolu, there is no contact information. See, I wish you were making this presentation when Mr. Governor, the Deputy Governor, the commissioners are here. I'll call you to go and do it again. But please, Daddy needs contact. The chairman of the board needs contact. I've just given you a job.
Thank you, sir. So actually, MedTrive in Ondo State has a coordinator. We don't want it to be something that, like the PSNYPG State coordinator is just a one-year tenure, except you want to do 2 years. So we don't want something that it will be repeated spaces year in, year out. And the coordinator for MedTrive in Ondo State is Pharmacist Taiwa Stevie. Stevie, please, can you come out? Let everybody see you. Come. That's the coordinator of MedTrive in Ondo State. And he has been working since last year. So if you need somebody to contact, yes, sir. So if you have job for MedTrive, you want to do anything, even your church, anywhere you want to do it, just contact Fam Taiwa. I will post his contact on the PSN Ondo State platform. So you can always reach out to him, and he will pay me for doing adverts. Thank you.
Tell
your phone number.
All right. My contact is no. All right. 070 63 86 1754. 070 63 86 1754. So for all your health and 070 063 86 1754. 070 63 86 1754. Thank you very much.
Thank you very much. Thank you, sir. Okay, so the money that will be paid is the money we are going to now for outreaches under MedTrive. We are not soliciting for support from companies because we are giving out. So the money will be used to, number 1, get drugs, number 2, logistics, number 3, security, tables, chair, canopy, everything that will make the outreach a success. Yes, it's free. Our service is free. Thank you.
Yes, it's a clarification. They are not charging you.
We appreciate the PSN chairman for the opportunity given to us to serve. We came up with a package for 3 days, and we wanted it to take place in all the 5 zones. PSN Ondo State is divided into 5 zones. We have Okitikupa zone, Ondo zone, Owo zone, Akoko zone, and Akure zone. And all this, we had meetings with the zonal heads, and we all agreed that each zone, we have a medical outreach and career talk. We are looking at Okitikupa zone. Please, the zonal coordinator for Okitikupa, is he around? Pharmacist Okusai? Where does he? He's not here yet. He's on his way. Lotto, please, you will stand up for recognition. Okitikupa on Monday had a career talk at one of the famous schools in Okitikupa, Stella Maris College. They addressed the students in the senior classes, SS1 to 3, and on pharmacy and pharmacy career and the job opportunities. This is the pharmacists and some of the students that were on that program. The next day, that was yesterday, they went on a medical mission at Ibekebo. And we can see the Kabiesi seated there. It took place at the Kabiesi's Palace. And our colleagues, they did blood pressure screening, diabetes screening, and some who considered to, they did HIV screening for them. I want to appreciate them. These are some of they had an health talk too. We can see some of their clients seated there during the health talk. We move on to Ondo Zone. Ondo Zone came up. Pharmacist, please stand up for recognition. Pharmacist Laoluwa, she's the zonal coordinator there. They went further to do a career talk. But their own is special in that they went for the young. The young shall grow. They went to the primary school where you have not even made up your mind whether you want to be a science student or a art student. They went there, talked to them, encouraged them. At the end, you can see the students in the background with some of our colleagues carrying the banner. After the talk, they made presentation of drugs to the school. I want to appreciate them from Ondo Zone. Then we move on to Ikare Akoko Zone. The zonal coordinator for Mrs. Oke she's not in the country, but she was represented by Pharmacist Peter Atere, who stood in for her. And they too had a career talk in one of the schools in Ikare Akoko. We can see these students. In fact, it's a very big secondary school, and all the students in the school were gathered in the hall. We have over 500 students there gathered learning about who a pharmacist is and what do you need to become a pharmacist. That's a picture of one of the presenters, and we can see our colleagues in the background and some of their staff. Okay. Sorry for the breaking transmission. So these are some of the students in the hall. As I said, we have over 500 students in that school, and some of our colleagues and staff took a picture in the background. Then this is one of the pupils and students asking questions about pharmacy, and we can equally see some of their teachers and our colleagues making presentation. We move on to our zone. On Monday, our zone had their medical mission outreach at Emurele, one of the towns in our zone. Pharmacist Bodede, she's the zonal coordinator. Can you please stand up for recognition? Yes, she's the one coordinating that zone. We can see our colleagues doing the BP check, blood sugar tests, then they were giving out drugs. And a lot of people, we had 135 people coming to assess medicine at that medical outreach. Yesterday, they had their career talk at various two secondary schools in Owo. One of them it was only for the SS students. One had over 100 students. The other one has about 80 students. These are some of the students in the background from the school and some of our colleagues. They were discussing about pharmacy and pharmacy career. And they were encouraging these science students to please do something about their life. Then in Akure, which is the state capital, we had the medical outreach yesterday at Ilesha Garage. I want to appreciate Pharmacist Adekola. He was the one who sponsored the canopies, chairs, and tables, all the logistics. We thank you, sir. And it was a very successful outreach. We had, that's our chairman in the background. And then, swap. Have you linked it? Okay. No, this one. No, this, it cannot come on this. Oh. We were actually trying to download the activities for yesterday because it was not on our platform. There. So this is Akure Zone. You can see our colleagues doing and some of the clients that came to access health services there. And then after we want to recognize Famade Olu, the zonal coordinator for Akure Zone. Please stand up. Thank you. He was the one who coordinated. We have over 100 clients there yesterday too to assess health. You can see from these programs that pharmacists are already meeting global health needs in our various communities. Now back to the pharmacy house. We have some companies that came in for exhibition. These are some of them at the exhibition stands. And then, lastly, not the least, we had a meeting that was facilitated by the state PSN between the Ondo State government, the Ondo State Drugs and Health Commodities Agencies, with some of our pharmaceutical companies. How can we bring these companies on board? We want to ensure that we have effective, efficient drug services. We want to ensure that our drugs are good, they are efficient, they are affordable, and they are of good quality. How do we bring these people on board? That was the essence of the meeting. I want to appreciate the Executive Secretary of the Ondo State Drugs and Health Commodities, Pharmacist Ayebusi. Please stand up for recognition. Yes, he was actually the one who coordinated that. And we had the PS from the Ministry of Health representing the commissioner yesterday at that meeting. I think it was about 2 hours. We judge on how to move forward in Ondo State. And those are some of the dignitaries and companies that came. Thank you very much. I want to call out your committee members. My committee members, can you come out for recognition? My committee members. My committee members, please come out for recognition.
welcome to the microphone the chairman of the occasion, the governor of Ondo State, who is ably represented by my own supervisor. He's the one supervising the Ondo State Contributory Health Commission, Professor Michael Simidele Odimayo, for the chairman's remarks. Please, can we put our hands together? We'll join another protocol again. The chairman is just coming in, so let's give him some time to absorb the system, then we'll bring him on board. Now, Ace, the official opening remarks. Is the program? So please permit me and let us celebrate our own. The chairman of the PSN Ondo State, Pharmacist Babalola Sabia Taiwo, for the chairman address. Please, can we celebrate our own chairman? The youth leader of the Elders Forum. Thank you, sir.
Thank you very much, the MC. I want to welcome all of us once again. Let me recognize the personalities on the high table again, and let me re-establish the protocol. Your Excellency, the Governor of Ondo State, here represented by Professor Odimayo. The Chairman, Hospital Management Board, Pharmacist, Dr. Taiwo Fashoranti. You know the twin brother is a pharmacist. First care. I recognize the PS of the Hospital Management Board. Our colleague, okay. Our colleague, Dr. Taye Adefuri, is a member of the Hospital Management Board. Your Excellency, permit me to recognize some of our leaders in this profession. Later. I have here a crop of skilled professionals. I'm even afraid. Many of them, when they take instructions from me, I feel humbled. Well, so one of them is our own Olori. By the time the wife of a Kabiyesi is taking instruction for you, because I made her as a member of the Pharmacy Week Committee. You are welcome. Then that table is a special table for our fellows. The fellows are our general in this profession. They are the general of pharmacy. We have all of them. I'm very rich. I'm very rich. The house is full of them. I have here I don't know whether to start from the left or start from. Let me start from the right of Olori. It was a retired PS. My Oga. You know, I served under her when I was in Ondo. He was the chief pharmacist in that place there. You are welcome, ma. Mrs. Pharmacist Osundolire. I know when you look at her, it's just like Sweet 16. Professor, have you seen my Oga? Next to her is, I call him the bull. The bull. He's a go-getter. He was is a former chairman of PSN Ondo State. He was a former director with Green Life Pharmaceuticals. Dr. Abiodun Ayeku. Now, I will go this way. Is it clockwise now or anti-clockwise? If I go here. The next person I will mention is a professor in the embryo, a researcher. Pharmacist Dr. Pharmakide. Members of the high table, I want to point your attention to something. You see, in our midst, we have different disciplines again. That is, we are multi-discipline. Next to him is a barrister, is a lawyer. Pharmacist in Wedoize. He's the zonal chairman. He's a barrister, he has a chamber. And that is why we are not afraid to take anybody to court. We have the resources. Now, I will come back to you. You are a fellow, but I will come back to you. Because myself, I have to salute you. I have in the house Pharmacist Mark Idowu, our silent elder. He is a pure and very fine gentleman who is very well interested in community practice. You will always see him on seat. A round of applause for him once again. I think the MC, you did not see one of our guys. I don't want trouble. You have not recognized her. Here present, this afternoon, we have a director who represented the director of NAFDAC. We have Mrs. Aliu. Thank you, Bon. And we have in the house our home too. I don't want trouble. We have in the house the council, the PSF, Pharmacy Council of Nigeria, representing the registrar, the state officer, Pharmacist Kingsley. I want to, but I have talked about him that is my twin brother. If it's my twin brother, it's me. Okay, I will come back to you. You can, when I look at this angle, I see a reminiscence of when I was young. Because by then I used to see beautiful things. Let me recognize my IPC and the former First Lady of PSN, Pharmacist Akindeko and his wife, and a beautiful wife, his beautiful wife. You are welcome, sir. If I don't recognize anybody at all, let me go to and recognize my friend who was my opponent when I was contesting. I will not fail to do that. I will not fail to do that. That is my affable, humble pharmacist, Alfred Olukoju. Stand up for recognition. It's my brother. You see, that Alfred is so sweet in my mouth. Let me come back to I think after God, she made today possible. I've never seen a workaholic like this. I told her that about 2-3 days ago, this woman will not allow me to sleep. By 11, she will be calling me. And I told her that it was the Holy Spirit that directed me that I should make her the chairman of this occasion, Pharmacy Week Committee. Please, I want you to give her a round. Pharmacist, Dr. Mrs. Funmilayo Oluwatimileyin. I salute. Thank you. And you see, he coordinated. You know, he had a free ticket. She should have been in Abuja now on one NGO ticket. They invited her. You know, that's money. They bought a flight ticket. But this woman told them, I'm not coming. We are doing Pharmacy Week. Please, a round of applause. That is commitment. That is commitment. That is committed. Now, let me recognize, because you know I have a home. I have a native town. My place is the gateway to Abuja. Ikwele. Have you ever been to Ikwele Junction? You should recognize that we take that place to Abuja. I don't know of this day. I knew when we started. I want to recognize one of the swine of the soil, Honorable Tope Imoleyin. He's a member of the SCDA committee in Ikwele, and the chairman and other ESCO members will be here very soon. So he's a front runner. Thank you. Oh, yes. Sorry, sir. I have craved for your permission. I cannot but recognize all members of the board of Hospital Management Board. You know my story with them. You know my story with them. I started being a member of that board as part-time member since 1992. I left in 2003, 11 years. So I'm recognizing Mrs. Adamolekun. You are welcome. She's a nurse. And I could remember at that time, as it is now, we always sit together at the table, the board table. I want to recognize a member of that place, HMB2, Mr. Chief Dr. Rotimi Wilson. God bless you, sir. Thank you for coming. And I thank you all for coming to support one of your own. I'm one of your own. Now that I'm on this assignment, our representative on that board is Pharmacist Akindeko Robinson, representing PSN on that board now. Can you stand up for recognition? Because they have not known you. Because by the time you will be coming. Thank you very much. We want to play our own pharmacist anthem before I come to my speech. No, my twin brother. You see, I will have lost my dinner if I fail to recognize him. My dinner was gone. He's a former commissioner in this state. Commissioner for town planning, physical planning. And if you see all these roads now today, he was the one in charge who made some areas cleared. Some places in Akura then was just like, what do you call it, Morocco, the old Morocco. So we thank you, we recognize you. He's a fellow of the Pharmacistical Society of Nigeria. And like it has been said, we are comrade in harm. Comrade in harm. So I want to thank you all for coming. As we go on, when I spot you, I will recognize you. Because I invited all of you here. So thank you so much for now.
Thank you very much, sir. Please, can we give you up for our chairman? The man we call BOT. Wasn't, sir? Please, up arms. Up arms. Please, may I, with all humility, invite all ABS members to come forward as we take the pharmacy anthem. While we will come.
All pharmacists, please, let's be on our feet. We sing after the count of 2. 1, 2. We pharmacists, we are proud of pharmacy. We members of our glorious PSN, Pharmaceuticals, Society of Nigeria. As men of honor, we join hands for pharmacy. Drug making, dispensing, counseling, compounding, drug advice, wholesaling, retailing, detailing, politics, administration, drug research, Nigeria. Thank you, everybody. You can go back to our seat.
Please, can we put our hands together for our APS members again? A big round of applause for them. There is something I know when I go to pharmacy. I don't know. Nurses say they are beautiful. But when you see pharmacists, I don't want to say they are more beautiful, but the pharmacists do it over the counter. Pharmacists do it TDS. If you know, you know. At this point, let me bring back to the microphone the chairman of PSN for his address, the chairman's address. Are we not clapping for our chairman? Are we tired?
Thank you very much. Yes. Let me now stand on the existing protocol. Your Excellency, with your permission, I still want to recognize one of our elders. That's Pharmacist Yomi Fadipe. Ladies and gentlemen, distinguished guests, it is with immense pleasure that I welcome you all to the opening ceremony of the Pharmacists Society of Nigeria Pharmacy Week and celebration of World Pharmacists Day. I extend my heartfelt greetings to our esteemed invitees, including the chairman of our local government, who is in absentia, then Honorable Topa Imole here representing the LCD, our East. I would also like to acknowledge the executive committee of the PSN, our fellows, former chairmen, technical groups, zonal coordinators, and the esteemed members of the press. Your presence here today underscores the importance of our collective efforts in advancing the pharmacy profession in Nigeria. Before I proceed with my speech, I must acknowledge the great work of the Pharmacy Week World's Pharmacists Day Committee under the leadership of Pharmacist Dr. Mrs. Fumilayo Oluwatimilei for putting together this great ceremony. The leadership of the committee displayed great commitment and excellence to ensure that we have a successful event. I'm externally grateful, man. Pharmacy Week serves as an annual platform for us to showcase our profession to the broader community. It is a time for reflection on our achievements over the past year and to strategize for the future in alignment with the global initiatives. The Federation of International Pharmacists, FIP, has designated World Pharmacists Day as a time to focus on specific goals and advance the pharmacy profession. This year's theme, meeting the global health needs, resonates deeply with the challenges we face in Nigeria and worldwide. The importance of this year's theme cannot be overstated. Meeting global health needs is paramount, particularly in light of the obstacles to universal health coverage that we face in Nigeria. Despite our efforts, health indicators reveal a grim picture. High maternal mortality rates, significant morbidity, and widespread inaccessibility to quality healthcare services. The unavailability of affordable medicines and modern medical equipment, coupled with the loss of skilled healthcare professionals due to the so-called JAPA syndrome, exacerbates these challenges. Moreover, the lack of stable government policies and commitment to healthcare delivery, along with a marked absence of political will to enforce existing laws and regulations, hampers progress in the sector. We are also confronted with discriminatory policies among health service providers, rampant corruption, embezzlement, and diversion of funds intended for healthcare services. The patronage of outdated equipment vendors further complicates our ability to deliver optimum healthcare. To dismantle these barriers and achieve effective healthcare delivery for our people, we propose several actionable steps. 1, increase budgetary allocation. Governments at all levels must commit to a minimum of 15% of their budgets as recommended by the WHO for the health sector. This financial backing is essential for sustainable healthcare development. 2, resource management. Effective management and allocation of resources within the health sector must be prioritized to ensure that funds are utilized efficiently and transparently. 3, capacity building, continuous professional development for health sector professionals is vital to keep pace with the evolving healthcare needs and practices globally. That is where I want to appreciate our governor, Honorable Lucky Orimiso Ayedatiwa. I was going through some, a round of applause. He's doing a lot in the health sector. I will soon come to the play. I will analyze to you. He's not pre-singing. I saw where you were training the PhD, those who are the lowest ladder. Last week, you trained them. That is capacity building, community advocacy, and procedure, some preventive and all those procedures. So I want to thank you for all those efforts. Incentivize, number 4, incentivize health workers. There should be fairness and equitable incentives for all health workers, ensuring no discrimination in recognition and rewards. Can I go through that place again for the representative of Mr. Governor to actually understand? Incentivizing health workers. There should be fairness and equitable incentives for all health workers, ensuring no discrimination in recognition and rewards. If I would say one or two things, sir. Thank you very much. A round of applause for the government of Ondo State. Number 5, conducive work environment. The governments must create an enabling environment and consistently upgrade health facilities to facilitate better services delivery. I know Ondo State has done much and is still doing in this area. We can break down the barriers and meet the global health needs of our communities. Utilization of retired personnel. We must leverage the expertise of retired health personnel by engaging them on a contractual basis to fill the gaps created by the workforce shortages. I've repeated this and I've said it several times. When I was in the HMB in those years, I don't know the particular time, we were engaging retired doctors, consultants, so that they fill the gap. We didn't have many doctors there, so the government can return back to that. If you want to employ me now, I'm still active, so I can. All our women, our elders, they are active on contract basis, and the government will gain. Instead of paying them anything when it is contract, you don't pay much. Thank you. 7, the government must expedite policies that will enhance the sustainability of universal health coverage. One example is the tax shifting, tax sharing, which is still crying for implementation. It is essential to recognize the pivotal role that pharmacists play within the health service supply chain. Our professional skills and versatility were tested during COVID-19 epidemic, which earned us a lot of respect across the globe. Today, the advanced countries are creating a larger space for pharmacists to operate. Unfortunately, our government spent a lot of resources to produce pharmacists who are daily lost to other countries with better health services sustainability. Over 20 of our colleagues have japa or relocated to other states for lack of incentives from the public service in the last 2 years. In Nigeria as a whole, from the available records of the Pharmacy Council of Nigeria, PCN, over 2,000 pharmacists have migrated from Nigeria in the past 3 years. And how many are we there? Just a little, approximately about 28,000 pharmacists. And today, I think they are a little bit below 20,000. Community pharmacists interact with patients more frequently than many government and private health facilities, often becoming the first point of contact for those seeking medical assistance. In many developed countries, such as the US and the UK and Canada, pharmacists have been empowered as prescribers of non-prescription medicines, enhancing their role in patient care. Countries such as Kenya, Botswana, Rwanda, and South Africa have adopted similar practices, underscoring the need for us to adapt and innovate rather than lament the challenges we face. I've said it once. When you increase the space, Your Excellency, when you bring in many skilled people into the platform, then you achieve a higher coverage of health for our people. Let them expand and extend their skills. Let them leverage on their skills. Like what I've been saying, pharmacists here, there is a lawyer. We have a chartered accountant here. If that one, you employ him as a pharmacist and he's serving somewhere as an accountant, is a good one. I will not be fear if I did not commend the efforts of our dedicated governor, Honorable Lucky Orimiso Anyedatiwa, for paying attention to the health sector in Ondo State. His recent launch of the informal sector health insurance initiative as part of the contributory health scheme is a commendable step toward achieving universal health coverage for our people. A round of applause for Mr. Governor. I also want to acknowledge the hard work of the Director General of the Contributory Health Commission, Dr. Oyenei, and his management team, who under his watch, the commission is performing very well. A round of applause for Dr. Oyenei. We are not unaware of ongoing projects under the Ministry of Health, such as the establishment of the Cancer Center ongoing and recruitment of health workers taking place concurrently at the HMB. These efforts are aimed at improving our healthcare services and our health needs. In closing, I thank each of you for your attention and commitment to advancing our profession and improving healthcare delivery in Nigeria. Together, we can break down the barriers and meet the global health needs of our communities. Thank you.
Birthday, happy birthday, happy birthday. May the good Lord bless you. May the good Lord bless you. May the good Lord bless you, A.B. May the good Lord bless you, for he's a jolly good fellow. For he's a jolly good fellow. For he's a jolly good fellow. And so say all of us. And so say all of us. Hooray. And so say all of us. For he's a jolly good fellow. For he's a jolly good fellow. For he's a jolly good fellow. And so say all pharmacists.
Happy birthday to you. Happy birthday to you. Happy birthday to you. Happy birthday to
Wow. I am humbled. I am very, very grateful for this honor. It is a very rare privilege for elders, men, women, senior, very senior colleagues to celebrate you. And one unique thing happened. Elder, the youth leader, he placed that helmet of the fellows on me. Thank you so much, sir. I claim it, sir. I claim it, sir. You told me already when we had that trip that this is what you would do to get there. Thank you so much, sir. I don't blow. I don't blow. I don't blow. No touch am. Okay. Mr. Chairman, sir, please don't pay my bill again. You know I charged you to moderate this. I charged you 100,000 before. But please, no, don't pay me again. I'm okay already. Thank you so much. Thank you. Please, right now, we are unique today because the live streaming that we have done, it has gone everywhere. We want to recognize our diaspora pharmacists who are watching live as we are doing this. All the way from Toronto, Fambola Lawan called, he said he's enjoying and he sends his greetings. Sir Pharmacist Omotiba from the United Kingdom has also sent his regards that he's seeing us and he said we are pace setters, that what we are doing, no state PSN has done this. Congratulations to all pharmacists of the Ondo State PSN. Thank you. So to bring the keynote address speaker on stage, let me invite the Director of Pharmaceutical Services of the Hospital's Management Board, Pharmacists Omoba, to give a short citation of the keynote address speaker. Thank you. Please, can we celebrate our DPS?
Good afternoon. The Executive Governor of Ondo State, Honorable Lucky Orimi Ayedatiwa, ably represented by Prof. Semi Dele Ojimayo. I also appreciate the chairman and board members, Hospitals Management Board, all the permanent secretaries, here represented, serving and retired. The chairperson, the chairman, Pharmaceutical Services, Pharmaceutical Society of Nigeria, Ondo State, from Dio Taiwo, the chairperson of this 2024 World Day Pharmacists Day celebration, fellows of the Pharmaceutical Society of Nigeria, and all the other staff. I'm standing on the other protocol that has already been established, standing on that. I have this great privilege to read the citation of the chairman of this September occasion for today, from Dr. Taiwo Adefuri. Please, sir, may I humbly request that you be upstanding. From Dr. Taiwo Adefuri is from Ilututu Okitipupa local government of Ondo State. Is a product of the famous Manual Memorial Grammar School, Ijodo in Okitipupa local government, and of the University of Benin Faculty of Pharmacy for his B.Pharm and later PharmD 1984, PharmD 2006. He did his internship in the Ondo State Hospital, Ondo Town, 1984/1985, and is a name and the NYSC at the General Hospital Abakaliki, 1985/1986, now Ebonyi State. He has worked in various capacities as superintendent, pharmacist, industrial pharmacist, also regulatory pharmacist, regulatory affairs, and also as a hospital pharmacist. He was a national sales manager with Orcheers Pharmaceutical Company, Lagos, before going into politics. He was the special assistant to the governor of Ondo State on local government and chieftaincy affairs for years. He was principal pharmacist of the Benedion University Teaching Hospital, Benin City, and he is a founder of Global PharmaWise Specialty Limited, publisher of the PharmaWise journals. Pharmacist Dr. Taiwo Adefuri is now a full-time board member of the Ondo State Hospitals Management Board. Ladies and gentlemen, distinguished guests here today, can you join me in presenting the pharmacist, Dr. Taiwo Adefuri, the publisher and CEO, PharmaWise Journals. You're welcome, sir.
Please, let's continue.
Although I am going to stand on the existing protocols, but I will need to recognize some of my leaders here and professional colleagues. The Executive Governor of Ondo State, Honorable Lucky Urimisan Ayedatiwa, ably represented by Professor Michael Simidele Odimayo. Good afternoon, sir. My own chairman, the chairman of the Hospital Management Board, Dr. Taiwo Fashion, the Executive Secretary, Ondo State Drug Management Agency, I recognize. My own PS, the PS from Ward 4 of the political spectrum in Ondo State, Dr. Ayodele Adiji, we are recognized. I want to recognize all my colleagues here. I can see so many of them, so many of us. Let me start from the group of fellows. Good afternoon, Mama Olori. Good afternoon, Ma. Good afternoon, Pharmacist Fumi. I used to call her Auntie Fumi when we were doing my internship. I can recognize my Egbon, my classmate, but it's my Egbon, Pharmacist Ibikunle Ashaolu Johnson. I recognize the past chairman of PSN in Ondo State, Dr. Ayiku. I also recognize my brother, who has settled down Gidigba in my local government, a lawyer and a pharmacist, Dr. Wendoze. I also recognize a fellow Pharmacist, Lusa. I recognize my colleagues and the Hospital Management Board, Nurse Aniola Adamolekun. I recognize Dr. Wilson Rotimi. These are astute politicians. Let me recognize also the representative of the Registrar of the Pharmacists Council, Pharmacist Kingsley. You are recognized. Pharmacist Olukojo, you are recognized. All the chairmen of hospital pharmacists, community pharmacists, ALPS, industrial pharmacists, we are all recognized. I use Dr. Fagbemi as a point of contact. That's a man I love so much because I like his name. He has a very unique name. His name is Dr. Emmanuel Mbobolo Nuduru Fagbemi. Still standing on this protocol, I want to recognize all pharmacists in this place. Good afternoon to the leaders of the Young Pharmacists Group. You are all welcome here. It's a bright new day in the pharmacy world in Ondo State. We are celebrating this year Pharmacy Week. And the theme of this year's celebration is Pharmacists meeting global health needs. Dear fellow pharmacists, men of honor, and esteemed guests, as we gather here to celebrate this year Pharmacy Week, I am greatly honored to be in your midst to address this special hall of esteemed pharmacists of the Sunshine State. Thank you, PSN, for giving me this opportunity to speak to our colleagues and rejoice with ourselves for this year's celebration of the Pharmacy Week. The theme for this year Pharmacy Week is Pharmacists meeting global health needs. We recognize the vital role that pharmacists play in ensuring the welfare and well-being of mankind. Pharmacists are the backbone of healthcare, working tirelessly behind the scene to ensure that the best possible care for quality health outcomes are given to patients. Pharmacy is not just a profession, but a calling. You agreed with me that you need a very powerful anointing to understand the mystery of drug and use the same to care for the mystery of God creation, which you find in the body of man and animals. Sometimes I marvel when I look at the mystery of immunology and the mechanism of actions of so many drugs that I have concluded that the Almighty God himself has graciously anointed us as pharmacists to understand this thing for the well-being of mankind. I look at the size and content of different pharmacopoeia. The BP, the Indian pharmacopoeia, the American pharmacopoeia, the Pharmaceutical Codex, and even the BNF. I studied the Bible and I studied the Quran. I read the Quran in Yoruba, and I could see very clearly that the energy of the anointing that is given to pharmacists to understand this thing is seriously mysterious. I will give glory to Almighty God. From drug design, production, into acceptable dosage forms, securing the microbiological integrity of each product, ensuring compliance with World Health Organization and regulatory standards, marketing, counseling on medication use, monitoring drug food, drug-herbal interaction, and general use of medication. Pharmacists have a very deep and unfathomable knowledge in the use of drugs to ensure patient safety. As pharmacists, we face a lot of challenges in our calling, such as identification of drug therapy outcomes that is a confronting mankind, antibiotics resistance, and quackery from the public. Drug therapy problem alone is a worldwide problem that kills more than road traffic accidents. While the workplace environment of the community pharmacists is gradually improving in Nigeria through the collaborative effort of the ACPN and the Pharmacists Council, the hospital pharmacists continue to face many challenges in their workplace environment. Improving the working environment for hospital pharmacists is crucial for their well-being, job satisfaction, and ultimately patient care. Here are some of the areas for improvement. Number one, the physical environment of the pharmacy and the hospitals. There's supposed to be ergonomic workplace design to make it suitable for the professional to practice. Adequate staffing and resources, modern technology and automation, comfortable break rooms and rest areas, and secure storage for medication and sensitive information. Then we talk of workplace balance in. Flexible scheduling and reasonable work hours for pharmacists, regular breaks and time off, support for continuing education and professional development, employee wellness programs and mental health resources, recognition and reward for outstanding performance. Then interprofessional collaboration, integrated pharmacy services within healthcare team, clear communication channels with healthcare professionals, collaboration, decision-making, and problem-solving, pharmacy representation in hospital committees, and interdisciplinary education and training. Then talk about patient safety and quality. Implementing the barcode scanning and automated dispensing system, standardized medication management protocols, pharmacists' involvement in rounds and patient care decisions, continuous quality improvement initiative, patient counseling and education program. Then staffing and training. Adequate pharmacists to patient ratio, specialized training for pharmacists in specific therapeutics areas, residency programs and mentorship opportunities, ongoing professional development and certification support, Diversity, Equity, and Inclusion Initiative. Then we'll talk about technology and informatics improvement for pharmacists, especially in the hospitals. We are advocating electronic health records, integration, automated medication reconciliation, clinical decision support system, and telepharmacy and service expansion, data analysis for quality improvement. Improving the working environment for hospital pharmacists requires a multifaceted approach. Hospitals should prioritize pharmacists' well-being, empower them to provide high-quality patient care, and foster a collaborative and supportive work environment. As professionals, we must embrace these challenges with courage and resistance, provide solutions to achieve better health outcomes to improve the quality of life of mankind. Statistics have shown that pharmacists are the most trusted people in their occupation. According to a recent Gallup poll, the poll ranked pharmacists third among professionals in the United States for honesty and ethical standards, with 66% of respondents raising their trustworthiness as very high and high. I think that one deserves a round of applause for pharmacists. The Gallup Incorporation is an American multinational analytical advisory agency based in Washington, D.C., founded by George Gallup in 1935. The perception of pharmacists in Nigeria varies among the public, but here are some common ones. The positive perceptions of pharmacists. Trusted healthcare professional. Many Nigerians view pharmacists as trusted and knowledgeable healthcare professionals. Accessible healthcare providers. Pharmacists are often the first point of contact for healthcare services, especially in rural areas. Medication expert. The public recognizes pharmacists' expertise in medication management and counseling. Community health advocates. Pharmacists are seen as advocates for public health, promoting disease prevention and health education. Yeah, we have the negative perception also, and I will mention just a few. They see pharmacists as having limited role. Some Nigerians perceive pharmacists as only dispenser of medications, underestimating the borders of pharmacists. The public may view pharmacists as solely profit-driven, people who want to make money, rather than patient-oriented. The public also may see pharmacists as lack of professionalism. Some individuals may perceive pharmacists as unprofessional or unresponsive to patient needs. Then the biggest challenge we have that is giving us negative perception is the counterfeit medicine concern. The prevalence of counterfeit medicines in Nigeria has led to mistrust of some pharmacists. And there are areas of improvement. These areas of improvement include public awareness campaign, educating the public about pharmacists' roles and responsibility. Enhance patient-pharmacist interaction, improving communication and counseling skill. Professional development, continuing education and training for pharmacists. Regulation and enforcement, strengthening regulatory bodies to combat counterfeit medications. The world needs pharmacists now, more than ever, to face the challenge of meeting World Health Needs. This is the theme of this year's Pharmacy Week. What then are the basic needs of global health? Number one is universal health coverage, pandemic preparedness and response, climate change and health, antibiotic resistance, global health security. These 5 factors are the one combined together that constitute themselves into a big challenge and need that the pharmacists can play very vital role. Pharmacists can play a vital role meeting these global health needs in several ways. Access to Medicare by ensuring access to essential drugs, particularly in underserved areas. Medication management. Pharmacists optimize medication use, improving quality outcomes and reducing the incidence of adverse effects. Disease prevention. Pharmacists provide immunization, health screening, and education on disease prevention. Chronic disease management, provision of strategies to manage chronic conditions like diabetes, hypertension, asthma, arthritis, osteoporosis, just to mention a few. Then infection, disease control, STI, HIV, malaria, hepatitis. Global health policies. Pharmacists provide information and shape policy decisions on healthcare system. The Ondo State Drug and Health Community Management Agency is a very brilliant world-class attempt to improve the management of drugs and consumables to ensure safety. I want to congratulate my brother, the Executive Secretary, for doing a great job. We all saw what you are doing when we visited you. We are happy that you are a pharmacist and you are doing well. Research and development. Pharmacists drive innovation in drug discovery, development, marketing, and delivery. I was greatly impressed at the contribution of this by biggest pharmaceutical company belonging to our IPC, Pharmacists Akindeko. I was in that factory sometimes ago. I saw what you are doing. You are doing great. All those great things start from small beginnings like that. Well done. Then health education. Pharmacists can educate patients in their community about health devices. Disaster response, e.g. during COVID, flooding, riot, and natural disaster. Again, I have to talk about Pharmacists Akindeko, our IPC. In the Aketi Ayedatiwa medical team, he was the one who produced most of the sanitizer that we use and the mask. The chairman of that committee is Professor Dimayo, who is my able leader. We provided all those things. He made sure that he gave me enough power to produce. Thank you, sir. By leveraging on the professional expertise, pharmacists can make a very significant impact in meeting these needs, improving patient outcomes, and addressing healthcare worldwide. This week, we celebrate the great effort of pharmacists to improve patient outcomes, advance healthcare from the Hospital Management Board, and on behalf of the governor too. You know I'm a politician. I'm first a pharmacist, I'm a politician. So from the Hospital Management Board, we salute all pharmacists, and on behalf of the governor, Orimisan, Loki, Ayedatua, I salute all of you. We recognize all the great things you are doing to serve the people of Ondo State at your duty posts, such as in the public service, in the hospitals, in the industry, in academia, communities, pharmacies, and political leadership. Let us be quick, finally, on conclusion, to remind ourselves that come November 2024, we as men of honor need to join hands with fellow citizens of Ondo State to vote for His Excellency Lucky Orimisan Ayedatua in the gubernatorial election. I want to believe that we are all lucky. Are you lucky? Are you lucky? Odatiwa. Thank you very much.
Please be seated. I bring greetings from His Excellency Governor Lucky Odimisun Ayedatiwa. I want to greet each and every one of you and appreciate you for the good work that you are doing. So I'll be standing on the existing protocol as already been well established. But even without that, I will not fail to appreciate the chairman of the Hospital Management Board, Dr. Taiwo Fasoranti. I was just whispering to him there that Pharmacist Taiwo Fasoranti or Kehinde Fasoranti, they are born on the same day, from the same place and everything. So it's just about doctor and pharmacist being brothers as always. So you're welcome, my brother. I want to appreciate all the board members of the Hospital Management Board. The guest speaker, the keynote speaker, has spoken expressly well, beautifully, and also as a member of the Hospital Management Board, I want to acknowledge him and also appreciate our nurse, Honorable Mrs. Nurse Patient Aniola. Amudamolekun, you are welcome, you are well done. The permanent secretary, Hospital Management Board, I think here we are just having the Hospital Management Board, especially being here, by virtue of the pharmaceutical society is all about making the hospital work and working to be sure the hospital is functioning well. Please let's clap for the Pharmaceutical Society of Nigeria. So I want to appreciate Dr. Adiji, the permanent secretary, the executive secretary, Mr. Chairman of the Pharmaceutical Society of Nigeria Ondo State Branch, our dear pharmacist BOT. Please let's give him a very special welcome. We have had to do a lot of discussion while we were there, and he has discovered that this government is our government. Ondo State is our state. And some of the things that he has been very concerned about, he has discovered that seamlessly they have been done. And I must really appreciate the commitment, the passion, the dedication of the chairman of the Pharmaceutical Society of Nigeria Ondo State Branch, Pharmacist BOT, for what he's doing for the Pharmaceutical Society. Please join me to clap for him. His commitment, his dedication, his passion to be sure that the profession is taken to greater heights and to be sure that the health sector in Ondo State functions excellently is really unparalleled. I want to appreciate you for a good job, sir. I want to appreciate the fellows of the Pharmaceutical Society of Nigeria, the Pharmaceutical Board, the fellows, our highly reverend fellows. You have been well acknowledged. Our mama, I greet you, ma. And I greet all the other members. You are well done, ma. You are well done, sirs. We really thank you. I want to thank the representative of the registrar of the Pharmaceutical Society of Nigeria. I know he's there seated. Please let me clap for him. Really appreciate you. And I want to also appreciate my brother, the Director of Pharmaceutical Services. I saw him there seated. You are welcome, sir. Is he still around there? I want to appreciate all the pharmacists from the executive, the entire member of this noble profession, the pharmacist. You know that starting even from secondary school, you discover that a pharmacist must be well versed in chemistry, in physics, in biology, and you can see that we have a great intellect, intellectuals that you have as pharmacists. And so you are highly appreciated. Please, I want to respectively ask you to clap specially for yourself. Governor Lucky Orimisa is a man that is passionate about the health of the people. His love for the people of Ondo State spurs him to do so many things that sometimes you'll be wondering, what is his interest? But you can be able to read it that this is out of love for the people. Right from the time that he has been in office, he has made sure that he strengthened and supported the health sector to be able to function, not just for the health sector alone, but for the health and the wealth of the state. Please help me clap for him. To make sure that our hospital is not just a consulting clinic, he has supported strongly the Ondo State Health, Commodity, and Drug Management Agencies. The ODISMA, that is, he has made sure that he supported the teams strongly to be sure it's working. For example, our venue, the place that we use for the drugs, that is the pharma grade warehouse project. As at now, the state has already provided its own part of the fund to be sure that that pharma grade warehouse project is functional. And I'm sure you can be informed or be informed that the pharma grade warehouse in Ondo State is the largest in the entire Southwest. Recently, in August 2024, there's already procurement and installation of solar energy inverter system, and even CCTV camera being installed to be sure that the drugs that you have there is fully functional, is maintained, and to be sure that there is adequate security and full functionality of the warehouse. The governor has consistently given his strong support to encourage the ODISMA project so that it can be able to offer its best to the entire team. I really specifically want to appreciate our the ES that is in charge of the Ondo State Health Management Agency, the Health and Drug Management Agency, for the beautiful work that he's doing. Each time I have to have contact with him, you can see that this is a man that is highly dedicated, is committed to the project, moving here everywhere to be sure that the Health Management and Drug Management Agency is able to function fully. Recently, interaction with pharmacists, with doctors, with CMDs across the state was done, and also a team that will be able to help to manage and to be sure that this agency